Um, Hello. Um, Thank you for joining me. Today I will be covering the basics of farrowing and different birthing presentations, um, and what to do in cases of abnormal birthing presentations. I have my notes kind of all over the place. This may be a longer video. So if you see me looking off, that's just because I have diagrams and notes all over the place. So pre-farrowing, that is before, obviously before farrowing, before birth. And I just want to add a reminder that when it comes to the process of farrowing, since there's a chance that you may need to help the sow with giving birth, you're always going to want to make sure that your tools and your hands are sanitized and disinfected. And it's key to be gentle and patient during the birthing process. It's also recommended that you use a fair amount of lubrication to help with delivery. And it's always recommended and very important to have a veterinarian on standby and to keep them in the loop in case anything happens. That way they can intervene. Okay, so gestation, the basics of it. Gestation will usually take 111 to 120 days. There's also the 3-3-3 rule, which is 3 months, 3 weeks, 3 days. And you're going to see signs of impending farrowing within 10 to 14 days of your sow or gilt giving birth. So you're going to have behavioral signs like nesting, reduced appetite, restlessness, standing or sitting. So she's going to be uncomfortable. And then you're going to have physical signs like a swollen or reddened vulva. And I have a picture there. And if these pictures don't come out great on video, then I will try to add them in through editing. And depending on your setup for raising pigs, you may want to take this time to move your mama pig into a farrowing crate. Okay, so active farrowing. This is when she's in labor. She's going to be showing signs such as laying on her side. She's going to be shivering. She's going to be uncomfortable, so she's going to be kicking at her side. Her tail might be twitching. So you will likely see these signs, and that just means that she is in labor. Farrowing can take anywhere from 3 to 8 hours, with an average of piglets being born every 10 to 20 minutes. However, the time between the first and the second piglet can be longer than 10 to 20 minutes. You may get up to 50 minutes. It's important to keep these times in mind because delay in these times can sometimes indicate some issues giving birth. Okay, so the first two types of birthing presentations that I want to cover are what are considered normal birthing presentations, and those are posterior or forward presenting, and anterior position, which is backwards presenting. So forward presenting is going to be head first. This is a common way that you see a lot of infants being born, and it's throughout different species. So this is a very common way that they're born. However, in swine, another normal position is anterior position or backwards position, which is where their back feet come first. This can be a little confusing, but it's not to be confused with the breech position, and I'll cover that in a bit. But for normal positions, there's not really much that you need to do intervention wise. Usually they should be coming out pretty easily unless there's something else going on. Okay, so now we're going to get into abnormal positioning. So the one I was talking about, breech position, this can sometimes be a bit confusing when looking between this and anterior positioning. The thing you need to keep in mind is that breech position is butt first. Anterior position is feet first. So with breech position, you're going to have some difficulty because the legs are going to be stuck on the pelvic bone. And I have my notes here. So what you're going to want to do if you are doing this by yourself is you're going to want to go in. Let me show you the picture. You're going to want to go in and carefully, and you're going to be wearing gloves, protection, everything's going to be sanitized before you enter your sow. You're going to want to hook your index finger, pointer finger, and your thumb, and you're going to locate by feeling, because the visual cue wise is going to be difficult. You're going to want to go in and carefully hook onto the leg and lift their leg so that they are no longer stuck on the pelvic bone. And this is pretty much it's similar protocol for the other abnormal birthing positions. Is you're going to go in and you're going very carefully, gently go in with your fingers, and you're going to do what you can to maneuver so that they are unstuck from whatever they're caught on. So you have breech position, which we just covered, which is butt first, and you're going to have the legs stuck on the pelvic bone. Double over position is when the butt area, in simple terms, is again stuck on the pelvic bone. So again, you're going to go in and you're going to feel, and you're going to assist with just gently adjusting the piglet and lifting them. Sometimes you may have to shimmy them a little bit forward so that you can lift them and unstick them from their spot. So since pigs give birth to litters, there's also a possibility that you're going to have two piglets presenting in the birth canal at once. And so in this case, it's going to be a similar procedure. You're going to go in, you're going to locate the piglet that is closest to the entrance. So the one that is making its way out first. And what you are going to do is you are going to basically, again, gently kind of, you may have to shimmy the other one a little bit to make more room. I say shimmy, but it's a very gentle process. You don't want to cause any injury by being too rough. You're going to go in and you're going to gently lift, kind of maneuver the piglet that is closest to the entrance. And you're going to very carefully maneuver them out. And then you are going to help maneuver the second one out. So another abnormal, sorry, I'm just making sure that my notes are in the right spot. Another abnormal presentation is called heavy uterus. This is when the uterus kind of forms an S shape. Doesn't necessarily look like an S in the diagram, but that's how they describe it. And so what you're going to do is, again, you're going to go in and you're going to adjust the piglet so that he is not stuck or being blocked by the pelvic bone. And usually helping the first piglet in this scenario helps fix that S-shape issue in general. And usually in that case, the rest of the piglets will be able to be delivered normally. Now, I want to also cover some other farrowing difficulties. These aren't abnormal positions. They're just some things that can happen during farrowing that can cause difficulty with labor. So heavy uterus. Did I just cover that? Yeah, I just covered that. Oversized piglets is where I was starting back up on. So oversized piglets, it's a given via the name, is when your piglets are going to be larger than the sow can necessarily handle giving birth to. All of these are all the abnormal positions and birthing difficulties can be considered an emergency, but these especially, you're going to want to get the veterinarian involved because it is very likely that they're going to need to intervene, sometimes surgically. So oversized piglets are especially dangerous because they can die in the birth canal in this situation. And if they're not removed, they can start to decompose and basically poison the mother pig. And another reason that this is can be dangerous is oversized piglets can cause the sow to become exhausted more easily while giving birth. And this can cause, again, more difficulties. So in this case, you may be able to help assist the sow give birth, but it's a good option to get your veterinarian involved to help with intervention. Uterine exhaustion, also known as uterine inertia, is another one where you're going to want to get your veterinarian involved. Uterine inertia is unfortunately a fairly common problem. And this just happens when the sow is tired from giving birth. And it can cause them to not be able to push as much, or they literally just become exhausted. So birthing becomes difficult for them. So you're going to want to get veterinary intervention. So there's two, I kind of pair them together. One is a full bladder and one is a full colon. And the names are kind of a given. So full bladder is when the bladder is full. Full colon is when the colon is full. The way you want to try and fix this issue is you're going to want to try and encourage the sow to stand, because this encourages them to either empty their bladder or defecate, which can fix the problem, because in these situations a full colon will push against the birth canal, and a full bladder will push against the floor of the birth canal, and this can cause less room, which can cause issues with giving birth. Underdeveloped sows and injured sows, you're going to want to get veterinary intervention, because these are risky situations. So for instance, an underdeveloped sow, her pelvis may just not be big enough to allow for the piglets to move through the birth canal or to be birthed in an easy manner. So your only option may be for a C-section in this case. And an injured sow, depending on the situation, there could be a whole host of problems. So again, you're going to want veterinary intervention for this. And then fat sows, overweight sows, they can have some issues as well, which can range anywhere from them becoming tired more easily, or them having a lot of fat that is pushing on the birth canal, which is causing issues that way. You may be able to handle it by yourself, but again, this is one of those situations where you may need veterinary intervention to help your sow give birth in a, I guess, healthy manner. And the only other notes for this video is that if you have a sow that you are using to birth piglets, like specifically for that purpose to create more pigs, and they are repeatedly having farrowing issues, it's time to retire that sow, because repeated farrowing issues is going to put stress on your sow. And yeah, that's pretty much all the information I have for this video. Again, if the pictures don't come out as well, then I will try to add them in via editing. So we'll see how that works. Thank you for joining me. I hope you learned something from this video.